The clinic I was at was in El Centro de Salud in El Tingo, which is one of the more rural outskirts of Quito, the capital city. This community is about 9,000 people, mostly lower income.
I worked at the Subcentro de Salud de Pifo, which is an hour and a half from the center of Quito. It's kind of right on the edge of the urban area.
I think something that is very different in Ecuador is the healthcare system. It is kind of a given over there that everyone has access to healthcare. They really focus on preventative health. Everyone that needs any type of medicine can see a doctor and get their medicine for free.
The Ecuadorian healthcare system in its design is way ahead of us. The health system there is designed to overcome a lot of the barriers to accessing healthcare that are not unique to Ecuador. I think it was cool to see an attending physician consistently do 30-minute visits. I don't feel like these docs lose any of the efficiency that family medicine docs who've trained to do 10 and 15-minute visits have. They just have this whole other level of connection and knowledge about the patient.
One thing that is very special about this clinic and many community clinics in Ecuador is that once a week the physician goes out into the community and does health visits. Sometimes it's people that they know are homebound or they know are too sick to come to the clinic.
Being able to do patient visits in their homes, it gives you so much context for the way that people are living, and it also kind of breaks up the power dynamic. Rather than asking patients to come to our space on our schedule, tell their story in a succinct way on our timeline, it's saying that I value you enough that I will make the time to come to you on your schedule.
When I went on one of these house visits, I really felt like part of the team. It was only one physician and me. I think being in that environment is really transformative.
In my clinical training in the US, I've spent a total of maybe like 1 day working with nursing staff. I think it's something we should do on every single rotation.
That separation between the hierarchy of medical positions was really not there. And I thought that was also very special. And I learned a lot of nursing skills, and I think that's going to be very useful in the future.
Students should be ready to have their core beliefs challenged.
Doing a rotation like this teaches you that other healthcare systems can be just as successful, and there are lots of things we can learn from them.
I would just like to express my gratitude to the team for welcoming me and answering all of my million questions.